So many people take supplements to reduce our risk of high cholesterol. Now there is new data from the American Heart Association conference last weekend that looks like our vitamins and supplements maybe not that good. Our 9 Health expert, Dr. Payal Kohli, joins us. Good to see you.
Good morning, Gary.
So I know lots of people take supplements, some daily, and what are the most common ones that are used?
Yeah, we spend $50 billion a year as
my.
Americans on supplements.
Wow.
And they've looked at this. The Journal of the American Medical Association says the most common reason people take it is because they want to improve their health or maintain their health. Multivitamins, as we just spoke about a minute ago, are the most common supplement, followed by calcium supplements that women tend to take for bone health, followed by omega-3s that more men tend to take for heart health. And what's interesting is less than 23% of these supplements that people take are actually recommended by a healthcare provider. So 3 out of 4 of them they're just kind of taking on their own. And we don't really have any research to say that they're doing us any benefit. They may actually be doing harm.
So how does that work? What kind of harm might they be doing?
So supplements can have bioactive agents in them. They're also, medications that your liver has to process. So this particular trial actually looked at 8 different arms. So, one group got placebo, which was essentially a sugar pill. One group got a cholesterol medicine called a statin. And then they tried a whole bunch of different supplements: fish oils, garlic, cinnamon, turmeric, cholesterol, red yeast rice, a lot of the things that a lot of us take. So, of course, the sugar pill didn't do anything. The cholesterol medicine lowered the bad cholesterol and the triglycerides. But some supplements, like garlic, actually raised your bad cholesterol. And the cholesterol, which has something called plant sterols, actually lowered your good cholesterol. So these supplements actually were doing harm and making the numbers go in the wrong direction.
Wow.
Some of them were doing nothing, and this was only at a month. And you can imagine if you had followed these patients longer, you could have perhaps seen a different signal.
Yeah, I mean, that's pretty interesting because a lot of people think that, hey, I'm going to be healthy. I'm just going to take this stuff because I saw it on TV or whatever. If you do have high cholesterol, though, there are ways to treat it, right?
There are ways, and our thinking has really changed about high cholesterol. In other words, high cholesterol is one of the hardest diseases to treat because it's got no symptoms. Your body doesn't tell you have high cholesterol until the day you have a heart attack or stroke or some other manifestation. So we really want to look early, and we want to treat it with evidence-based therapies such as statins. Now, people that want to change their diet, about 25% of your cholesterol comes from your diet. 75% comes just from genetics, what your body makes. But if you follow plant-based diet or go vegan a couple days a week, that can help. Increasing the fiber in your diet can certainly help to lower that bad cholesterol as well. Exercise, losing weight, those are the natural ways to do it. But really stay away from those supplements because you could actually be harming your cholesterol, increasing your risk for side effects. Fish oils, for example, can cause heart arrhythmias like atrial fibrillation. They can thin your blood. So we want to be sure that what we're putting inside our body, first of all, is FDA regulated, and we're getting the right doses of stuff, and secondly, that it's actually doing benefit, not harm.
Wow, interesting stuff. Dr. Kohli, as always, good to see you. Thanks.